This video is an overview of performing a test using the Midmark digital ECG. Always refer to the appropriate technical documentation for the complete list of instructions, safety alerts, and sequence of procedures before conducting any service or maintenance operations. Attaching the digital ECG. With the electrodes in place, attach the ECG clips from the patient cable to the electrodes in accordance with the lead labels or color codes at the end of the patient lead. A common mistake to avoid is switching the right and left leads. Please remember that the right and left designators on the patient cable refer to the patient's right and left. Starting IQ Manager and creating a new patient. If you are using the Midmark digital ECG, with an EMR, refer to your operation instructions for creating a new patient chart. This section of the training video is created for clinicians who are using Midmark IQ Manager software to manage their patient records. Double-click the IQ Manager icon on the Windows desktop and the opening screen will appear. To create a new patient file, click the New Patient icon. On the IQ Manager patient data screen or in your EMR patient chart, enter the patient's name and ID. Some information may not be essential for the acquisition of an ECG. However, it is important to complete each of the fields as accurately as possible, particularly date of birth, gender, and medications. This information is used by the Midmark 12-lead resting ECG analysis program to produce appropriate diagnostic statements. The Midmark analysis program is capable of interpreting ECG tests from newborn to adult by using age-dependent criteria. The program automatically calculates the age of the patient based on the date of birth entered on the patient data screen and the current date of the computer. Please make sure that the date and time on your computer is current. Select Save to navigate to the patient data screen. Starting the ECG test in IQ Manager. Once the patient is properly prepared for an ECG test, follow your EMR operation instructions to start the Midmark ECG test. For IQ Manager users, select New Test on the menu bar that appears on the patient data screen. Next, select from the drop-down list or enter the names of the technician conducting the test and the requesting physician. Enter the diagnostic reason for the ECG test in the indication field as needed. Click the Start Test icon in the right-hand portion of the Midmark digital ECG device. The live ECG screen will display the 12-lead ECG in the 3x4 leads display format. Filters and settings. For all pacemaker patients, it is strongly recommended that the ECG be performed with all filters turned off, particularly the muscle filter. The gain, speed, and filter settings are displayed above the moving tracings. Select the appropriate drop-downs or toggles to modify these settings if needed. Changes to these settings made from this screen are temporary and only apply for as long as the test is active. You may make changes and set them as the default settings for all new ECG tests by selecting Settings. The patient's name will be displayed at the top center of the screen, with the heart rate displayed on the top left corner of the screen. Lead-offs or any error messages will be displayed on the right top corner of the screen. Saving an ECG report. Wait for the ECG tracings to pass the screen twice, then verify the signals are clean and baselines are stabilized. Select Acquire to capture the last 10 seconds of the ECG. The report will open in the Report Review screen so the technician can review the quality of the test before saving the report. To save the report, select Save. Otherwise, click the X button on the top right corner of the screen. You will be prompted with the option to retest, save, discard, or cancel. Retest will discard the current report and return you to the live ECG screen so you can acquire a new ECG test. Save, similar to the Save button on the live ECG screen, will save the ECG report and return you to the patient data screen. Discard will discard the current report without saving it and return you to the patient data screen. Cancel will remove the prompt and you will remain on the ECG review screen. Completed ECG. When the ECG test is completed, remove the ECG clips from the electrodes, then remove the patient cable from the patient and set aside. For more detailed information about performing a test, please refer to the Midmark Digital ECG Operation Manual. For further support, contact Midmark Technical Service at 1-844-856-1230, option 2.